what sets Iboga apart from other psychedelics and what's made it different. It has a very grounding nature about it, in the sense that all of the kind of insights that you're receiving from the plant medicine are going to be about you, rather than being like, oh, I saw this beautiful rainbow colored jaguar and it was amazing, but I'm not really sure how it applies to my life. Iboga, it tends to be very introspective and very specific to like what's going on for you inside your mind and body.
All right. Welcome to the Alliance podcast. I'm your host, Dr. Nikhil Sharma, and I'm so grateful to have you all with us here today. Today, we're going to be talking about psychedelics, specifically about Iboga. Really excited about this topic and to discuss more about its healing properties. Joining us today is my co-host, Kevin Drummond, who is a growth and mindset expert. What's going on, man? Glad you're here with us today.
How are y'all doing? Happy to be here. Happy to dive in and hear more about Iboga and other psychedelics. And she's in Portugal. I just came back from Portugal last year where I got engaged. So I'm excited.
All right, and we have our guest today, Madison Callahan, who is the director at Iboga Healing Center in Portugal. Welcome, Madison. So grateful to have you here with us today.
Thank you. I'm really happy to be here and just share more about all this exciting research we're doing with Iboga.
All right. Yeah. For me, it seems like, psychedelics has been a distant part of my life, I want to say. We hear about it growing up, not in the healing context, but while I was growing up, there would be like MDMA, ecstasy, and it would be more for like recreational use. It was only in the past several years where I started hearing more about its healing properties and how it can actually, get us through mental blockages, depression, anxiety, addiction. And it got me more curious as to why this is now coming onto the scene. And so I did a little bit of research, in the background, and come to find out, back during the Ronald Reagan administration and during that era, there was a big thing against the war on drugs, and cocaine and heroin had ravaged a lot of our cities and a lot of our states. People were dying left and right, and so that administration made a big push. And it just so happened that psychedelics got put into that same category just when psychedelic and scientific research had just begun, and there was a lot of interest that was going on with the healing properties of psychedelics. But because of that war on drugs, all that got curtailed, and it's taken a long time, a lot of political endeavors to help promote this. And now we are seeing research done on it in many major centers like Johns Hopkins Psychedelic Center, Stanford has one. Many universities across the United States are doing a lot of groundbreaking research on psychedelics, and it's just truly exciting. I went to a recent conference about it, and you're seeing people like Aaron Rodgers speaking about it there and his usage, as well as Jaden Smith and many other celebrities who have found how impactful and healing psychedelics can be towards our mental well-being journey. So I'm hoping the audience will get something out of this, and really just excited to hear a little bit more about your background, Madison, in terms of what got you into psychedelics. What was going on in your life that you felt like you needed to try it, and what were you gaining to experience out of that initial test of your psychedelics?
Yeah, that's a great question. So I've been working with Iboga plant medicine for about 11 years now. Before finding Iboga, I definitely had experimented with psychedelics recreationally, like psilocybin, LSD, stuff like that, but it was more in like a fun atmosphere. Before finding Iboga, I was already studying other earth-based indigenous spiritual traditions. And that's the path that really led me to Iboga plant medicine. And then, my first journey with Iboga, I think the mission for me personally was kind of healing myself of some of the traumas that I took on or experienced as a child, as I was in a position where I was starting my own family. So moving into motherhood, coming into raising my own children, I really wanted to like clean the slate and prepare a nice space for me to raise my children free from that baggage and free from that trauma, or at least as free as we could be, you know? So Iboga was definitely a healing tool for me to learn more about myself and how to be the best person, wife, sister, friend, and mother that I could be. And it's been a long journey. I've worked, you know, in Costa Rica, California, and now we are firmly rooted here in Sintra, Portugal. Yeah.
That's incredible, right?
Mhm.
And so, out of all the other psychedelics, what kind of drew you to the Iboga plant specifically? And if you can just talk a little bit about the background of Iboga and Ibogaine, where it's and how it's progressed into, becoming a healing source for people.
Yeah, definitely. So Iboga is a plant that comes from equatorial West Africa. It grows only in 3 countries in Africa. It grows in Gabon, Cameroon, and the Congo. And it's the root of the plant that we're using. So traditionally in the villages there, it was used for healing, either during a rites of passage, like an initiation type experience for the youth as they were entering adulthood, or for healing later on in life, you know, for traumas, illnesses, ailments. You know, the range of things that Iboga is good for is really large, and we can get to that later. But there was a time in about the 60s where they received the wisdom within the village that it was time to share Iboga with the world. It was like a clear message for them that this medicine was needed now. And so they started putting it out there, you know, and traveling and bringing Iboga to different places, thankfully. And it's grown in popularity as it's been recognized for its healing properties. There are 2 different kind of schools of Iboga use. There's what we're doing, which is using the whole root bark, the same way that they do in Africa, in a traditional ceremonial setting. This is most often for mental illnesses like depression, anxiety, PTSD, bipolar disorder, traumatic brain injury. We also work with some physical ailments like Parkinson's disease and MS and other nervous system disorders in this format. And then there's Ibogaine, which is a pharmaceutical derivative of Iboga, where they've isolated just the alkaloid that specifically affects addiction. So this is most often used in a clinical setting with doctors and nurses to treat people who are addicted to opiates or amphetamines or something of that nature. So there's kind of those 2 worlds of Iboga, but what I've studied and what I work in is that ceremonial traditional use.
All right, thank you for explaining that, because we often, hear both those terms, and that gave a lot more clarity as to what Iboga is versus what Ibogaine is. So, and the one great thing about Iboga and all these plants is that these are things that are grown right from our Mother Earth, right? And it's so incredible what our Earth gives to us to help us on our life's journey. I mean, I just find this, incredible. And for many generations and many centuries, Eastern medicine was all about plant medicine, and its healing properties. But then, over time, for many reasons, that we kind of went away from that and more to these pharmaceutical pills that are used for treating our mental well-being. Things like Lexapro and things like Klonopin or anti-anxiety medications. Right. So those medications have so many side effects that people don't realize. And it's become a culture almost that as soon as something happens, like you walk into the doctor's office and you're like, I'm not feeling great about myself. Boom, here's a pill that'll help you make you feel better, right? And a lot of times the doctors are so busy in the hospital or in the clinic that they don't even have time to discuss or educate with the patient what other options are there for you, like any mindful techniques. Maybe start with meditation, making yourself more aware of what's really going on around you, kind of slowing your brain down, or even options like Iboga, psilocybin. it's just the way, that's how the culture is these days in healthcare.
Yeah.
It's like, all right, you come in, boom, here's a pill, see you in about 4 months, and see how you're doing. Not even really discussing what their side effects are, which can be, sedation, and it mixed with narcotics, it can be deadly. And so here we have something that the earth has grown for us that has such tremendous healing properties, that I'm just excited how this is now coming back into the forefront. And I feel like there needs to be an integration of both Eastern medicine and Western medicine, and that each human is on their own journey. They're on their own path. What works for one person doesn't necessarily work for another. And we should have more options to be able to pick and choose what we feel is best suited for us and our mental well-being.
Yeah, completely agree. And increasing the awareness of things like Iboga and how it can help people. And that was one of my questions for you, Madison. Like, how did you find out about Iboga? And my second question was, how did you know that you had trauma and that trauma could be removed to be a better mother, be a better wife? Like, how did those pieces come together for you?
Yeah, so I think, being within the healing community already, I think there was a lot of other modalities of healing and the concept of healing and what that is presenting themselves, right? Whether it's talk therapy, or whether it's Reiki, or whether it's sound healing, or whether it's a plant medicine, these are things that my community was openly discussing. And I feel like Iboga is coming in a time when something very grounding is needed. I think what sets Iboga apart from other psychedelics and what's made it different, and actually it's not technically a psychedelic, it's classified as an entheogen, but it has a very grounding nature about it, in the sense that all of the kind of insights that you're receiving from the journey and from the plant medicine are going to be about you. Rather than being like, oh, I saw this beautiful rainbow colored jaguar and it was amazing, but I'm not really sure how it applies to my life. Iboga tends, because it's a root, it tends to be very introspective and very specific to like, hey, how are you? What's going on for you inside your mind and body? What can we change to make sure that you're really living that life of joy and purpose that you deserve? So a lot of people are finding this medicine that maybe have tried other healing modalities and have explored or researched online or been like, okay, I've been depressed for 10 years and I've tried taking the pharmaceuticals. And actually what we're seeing in that regard is that it's not actually working. They're taking the medicine, but they don't feel better. Maybe it works for a little while, like as a Band-Aid. Maybe it helps them cope and they can keep their job and get by and stuff. But deep down, they're still not feeling fine. So, we receive a lot of calls from people who are taking medications or who do have treatment-resistant depression, that this is like their last resort. They're just like, I just need to be better. And I've been researching it online usually, and I found you guys. So it's really exciting to see what Iboga can do for those folks who have tried other things and it just isn't working,
I think that's really a great point that you made. And the thing that people also need to realize is that Iboga, along with some of these other medications, they actually cause you to have neurogenesis, correct? And so with neurogenesis, you're having new nerve formation, which is different than neuroplasticity, which is when your nerves are reconnecting to different nerves to form new neuronal pathways. You're actually forming new nerves, new neurons. So that's new thoughts, that's new ideas, that's new ways of thinking, right?
Yeah.
That's not what those medications like Prozac, Lexapro, they're not doing that. They are just adding more serotonin into your system, right? It's not going to necessarily change the way you think and do things. Certainly it has its benefits. I know many people who have done well on those medications. But again, those medications have side effects, low sodium. And we see that all the time in the hospital and numerous other things that, hey, you know what? Maybe this isn't the route for me. but maybe trying something like Iboga, psilocybin, those types of medications might suit me a lot better. And I'd be curious to know, for the patients that come to see you that have been on those types of medications, what's like the procedure that happens with that? And do they, when you follow up with them, do many of them stay off of those medications and feel like they can do well without them?
Yeah, those are great questions. So, our intake process is extremely thorough. We do a full medical intake, which includes like a full health form, diagnostics as far as what medications you are taking. We also require an EKG, which is just like a simple heart reading. We just put safety first. So that's definitely a big part of the process. Iboga is one of these medicines that there are several pharmaceuticals that are contraindicated with Iboga use, such as everything that treats depression and anxiety, and all of that classification of medications do not interact well with Iboga. The reason being is that Iboga is wanting to access the same receptors in your brain that those antidepressants are currently occupying. And so when they get in there, they kind of get in like a little bit of a fight, and that usually doesn't present very well. So what we do is we have a pharmacist that we work with who, if needed, can help people taper down off their medication in a safe way, because you never want to just stop taking something that, you've been taking for some years. There's kind of a lot of protocol for safety around that. So usually, let's say someone is taking antidepressants, they're going to get a schedule for tapering and getting off of those medications in preparation for their Iboga retreat. Sometimes that's a 2 months, let's say, roughly window of tapering, and then having some time where there's no medication in the bloodstream before experiencing Iboga. Now, I kind of realize it's a bit of a catch-22 because you're coming to the Iboga to get off the medicine. But we need you to get off the medicine before taking the Iboga. However, you have this light at the end of the tunnel and a reason why you're doing this. And that's to prepare yourself for this ceremony that, rather than being like a lifelong Band-Aid that you need to take forever, is something you're going to experience deeply for the 8 days that you're with us. And then, yeah, I would say, we're still working on how to qualify the data, but about 75% of our guests do not return to taking their medication and do not feel like they need to revisit those modalities anymore. I have the privilege of doing integration for our guests, so I get to talk to people 6 months, a year, 2 years later, and it's just beautiful to see how it continues to unfold, and how, like, once you've entered that realm of health, you can really like keep taking yourself to the next level. Because Iboga is also not habit forming. It's not something people are going to do 10 times. They're probably going to come to the retreat once, maybe again a year or two later, but that's enough usually for folks. Yeah.
Right. And that's important that you mentioned that it's not habit forming. In fact,
Yeah.
it's helpful for addiction itself, right?
Yeah.
So, it's something that it needs to be made clear to people that these medications that you're taking, like Iboga or other medications similar to that, it's not something that you need to take every single day. And it's best done on these types of guided retreats where you have professionals that are helping you walk through the experience. I love that you have the integration process that remains 6 months, 1 year, and 2 years post your retreat. Do you think that you could just maybe explain to our audience what each day is like when you enter the retreat? What patients typically experience when they're on Iboga? Like, are they having, I know we mentioned that there's no, it's not considered psychedelic per se, but are they having some visualizations? Are there any side effects to Iboga at all that people need to be aware of as well?
Yeah, definitely. So our retreat is 8 days long. So I'll just kind of walk you through the days, and within that will be the Iboga ceremony itself, which I'll try to give words to. It's obviously can be difficult to describe, just like describing any other psychedelic. It's a little bit like different for everyone. But basically day 1 at our retreat, that's just arrival day. That's just your day to get here, make your travel. A lot of people are flying in. get to the center, settle in. We'll usually have an orientation circle just to go over any questions anyone has, allow all the guests to meet one another and meet our providers. We're operating in a semi-private structure right now, so we have a maximum of 4 guests per retreat, which really helps that quality of care stay really high, which is really important to us. And then getting a good night's sleep in your room. On day 2, you'll have a one-on-one with your provider. And this is a very important time to discuss with your provider more about yourself, your life, what you've been through, what are your goals and intentions for your ceremony, you know, why are you here? And just like get to know each other. So you're building that little trust bond before the actual ceremony. There's also a written exercise that we do in preparation for the ceremony on this day that just helps us get our mind in the right place and get those juices flowing around. What do you want to know about your life? You know, where are there missing pieces? And what questions do you have, you know, for yourself? When the sun goes down on day 2, then we'll gather around a fire. This is where we're going to talk about the Bwiti tradition, which is the African tradition where we've learned about Iboga from. This is where all of our providers have been trained and initiated and, you know, given permission to use Iboga in a safe way. And we'll be talking about life. And then everyone takes the medicine at the same time. It's in the form of a dry powder on a spoon. And it's just whole Iboga root bark ground up. We don't alter it or extract it or change it in any way. It's just out of the ground and we grind it up, and you know, it's a little bit bitter, but you can use water to wash it down, and everyone gets it down. And then you'll start to feel the effects of the Iboga within maybe an hour to an hour and a half. And your first feeling is going to be like, ooh, I think I'm ready to lay down, you know? So when you tell us you're ready to lay down, then we're going to bring you to our prepared temple area, which is just near to the fire. And there will be like a little mattress for each person to spend the night on. We have the traditional music playing that's been recorded live in the village that was developed for healing, you know, could be called sound healing in a very ancient way, definitely. And that's where you'll have your experience. You know, Iboga is an entheogen, which means it's a very introspective experience. Like we even have little eye covers because light can be a little bright and sensitive. And you are having visions, but it's mostly happening within, maybe in your mind's eye, maybe in your heart space. If you do take the blindfold off to like walk to the bathroom, it's just that light is quite bright. Things might look a little bit different, but it's not really an open-eyed visual experience like mushrooms can be or something like that. So most of it's happening within you. You know, a lot of people have described like going through a life review of all of the different stages of their life and how they grew and what types of conditioning they were subjected to, or traumas or positive things, and how it shaped them. And I think in connecting those dots, we're really making sense of why we are the way we are, or maybe why we can change some of our behaviors that are trauma informed based on things we've experienced in our childhood. So it's a very deep dive. It has a long life. So it takes about 10 hours, I would say, more or less, the journey itself. When the sun rises on day 3, then we'll take you back to your room for rest and integration day. And this is a super important day. The house is usually very quiet and you're just processing your experience. You know, our providers are there with you throughout the week. You're never going to have a moment where you're like looking for someone. Like, we're going to be there making sure that you're doing fine, bringing you some fruit, checking on you, but also having that, giving you that space to have your own personal experience. And then we do that whole process again. So once you've rested, recuperated, eaten some food, discussed, you know, then we'll do one more ceremony all night in the temple, another rest and integration day. And then on that final day, we usually go to the beach or somewhere beautiful, you know, before everyone departs. So that is the flow of the week. And I would say, as far as side effects with Iboga, I mean, during the screening process, during intake, that's when we're going to make sure that you're set up for safety. By the time you're here on site, we know you're good to go, right? So the side effects are all really positive. I mean, like I mentioned earlier, we work with also just physical illnesses. It's really becoming amazing to see how much Iboga is helping with nervous system disorders specifically, like Parkinson's disease, MS, traumatic brain injury. So it's very good for the body in a lot of ways, definitely.
Wow, that's really
Yeah.
incredible. Like I actually didn't know about those healing properties when it comes to nervous disorders and movement disorders, and so it's really encouraging to see what this medication, and this plant can really do for our entire nervous system, for our disorders, for our mental disorders, physical disorders. It seems like possibilities are endless, and that's what's really beautiful about this.
Yeah.
And so what about the integration process when people leave here? I know you mentioned that you have follow-up calls with them. Take us through what that is like.
Yeah, definitely. So, as much as Iboga has this amazing potential for healing, we've worked with, I think, about 2,000 guests now at this point over the last decade. So we've seen people from all walks of life, experience the benefits of it. But it's also not a magic pill. It definitely means committing to doing the work for yourself, sticking with your goals, and staying on track, with your life and the wisdom that it gives you to then implement that, right? So integration is everything that happens after you leave the retreat. Once you've left the care of our providers, this begins your period of integrating those wisdoms, insights, downloads, new feelings, like new neural pathways and synapses into your day-to-day life. And for us with Iboga, we say that the bulk of integration takes about 6 months. It's like a 6 months window that you're going back home and butting up against your home environment and going, okay, actually, this doesn't work for me anymore. This works. I need to change this. Some people are laying there on the mat having their journey and they're like, my job is making me miserable. And that might be like a tough pill to swallow. Maybe they put a lot of money into the education that they got to get to that job, but actually in realizing their truth, that it is not fulfilling them and making them happy, they're only going to get closer to this better life faster. Rather than just saying, it's fine, I paid for college, I'm just going to keep going.
Yeah.
Right?
I agree. Like I completely sympathize with that. I relate to that. I went to medical school, and paid, a good amount of money to be there. But over time, I started realizing that this is not bringing me emotional fulfillment anymore. And oftentimes, a lot of people, despite that, they'll be like, well, I make a lot of money and I am having a nice house and I got a nice sick car and all my pictures on Instagram look awesome, right? And so it's very materialistically driven. But inside, they're becoming a lot more resentful every single day. And they'll notice themselves projecting on other individuals. They notice themselves being angry. They're starting to drink more. They're escaping the reality, despite, and so that they're not realizing that they're escaping their reality, and they're not realizing that, hey, the environment I'm around right now isn't suited for me anymore. And I need to make a change. And that change is very difficult for people. So when you're mentioning that when you go back and you guys reach out to them and have this whole integrative process, I think it's really important for people to understand that you're right. There is no magic pill for all of a sudden your life to just turn around and you're going to be this happy-go-lucky individual. Because when you go to these retreats, you are in a pink cloud. You're in this completely in this structured environment, like that eliminates distraction from you. But eventually you need to go back into reality where your job is waiting for you, where your kids may be waiting for you, where many other distractions are all there. And so it's during that time period where the things that you learned during the retreat, you need to start integrating what you found out about yourself. What you found out makes you happy. And a lot of that will mean eliminating things in your life, changing the groups that you hang around with, changing your friends, changing your career. It is all about you finding what makes your soul happy. Because when you find that, you can create so much abundance in your life, you won't know what to do with it, because you think that what you're doing is a job. It just feels a part of who you are, and it's like your purpose, you know, and that's truly beautiful.
Yes, absolutely. And that's what integration is, you know, is like going home, and not for everyone. Some people love their career and they don't need to change that. But, you know, it's just an example that integration is not always easy. Sometimes there's big moves we need to make when we come back from this retreat. And I think the beauty of Iboga, though, is it really connects you with yourself in a way that, like, even if the changes are hard, you know why. There's a deeper feeling of like, okay, but I know that I'm supposed to make this change. I'm not wondering anymore or second guessing myself or being like, should I leave my job? You're like, this is what I need to do, even if it's hard. I think there's a sureness. And I think a lot of people leave quite excited to get home and see their families and hug their loved ones and be back in their home space without all of that baggage that they were previously, you know, carrying around. So integration is important, and our program comes in the form of just calls, video calls with usually myself or another team member, just to help remind you, like, oh, remember during your journeys, this is what was coming up, you know, how's that going for you, and implementing that, and just being that kind of person that knows what you experienced. If you are thinking about doing any retreat, definitely ask about their integration programs and what they entail, because I think that's really the key to success, is having support afterwards, for sure.
Yeah, I love that, you know, you mentioned that. And that's why I think it's important for those that are seeking answers to some of the questions that they're having in life, or seeking any kind of healing of trauma that they've experienced. It is important that we do these medications, and like psilocybin and Iboga and MDMA, all under the guidance of trained professionals who have a whole plan for you. You know, that's the most important part. Us doing it on our own, sure, may, if we're intentional about it, may give us some answers. However, in order, I feel, to get the full effect, you need to be more intentional with it. It needs to be done under supervision, and there needs to be an integrative process that occurs once you have finished that experience that lasts, you know, 6 months, a year, and so that what you have learned has actually been integrated into your everyday being.
Yeah, and for your safety, because maybe you decide to take Iboga at home, but you haven't had that whole health screening intake protocol. Maybe you're taking a medication that doesn't interact well with Iboga or whatever, and that's just not going to be nice for you, for sure. So there's a lot of components there as far as choosing a professional, definitely.
All right. Well, look, it's been a true pleasure to have you here with us today, Madison. Is there any final words or thoughts that you would have for our audience, for those who are interested in trying out Iboga?
Yeah, I would just say feel free to reach out to us. You know, our website is iboga-healing.com. We have all of our contact forms, and also you can just read more about Iboga on there and see if it might be something that's right for you. Definitely for people who are experiencing depression and anxiety and have maybe tried other things and they aren't working, I would say just do a little bit of research and maybe listen to like the testimonials from our previous guests, just to hear how their experience was. That's a really great way to kind of hear firsthand how it is for others. Yeah.
All right, and we'll have more in the comments section below to reach out to Iboga Healing Center. And until next time, peace.